wealth buying assets. About to buy me an address. I'm running with the runners now. We run where the cash is. Took it from under the mattress. Now it's all over the.
All right, welcome in everyone. Super pumped and excited today. We have one of the runners as a guest with us, Todd Palm, who is super knowledgeable about healthcare. And he's going to share with us the changes and advances that have happened with 7K Health that just make it even more unbelievable and just providing so much value for people. Before we hear from Todd, I know Ricardo's just excited about everything that 7K Metals is adding to this membership. So Ricardo, before we bring Todd on, maybe just kind of, let people know, what's happening with this company and how much we're helping people win.
Yeah, definitely, Mike. I mean, I'm excited for this presentation, this information, man. It's phenomenal because we know people need options and they need real solutions. And this membership is so dynamic, with this company. Not only are we building wealth with, precious metal assets and doing things in this space that quite frankly haven't been done and creating a lot of value, but they've added this healthcare plan, this option that is this premium. It's phenomenal and people need it. And so I'm excited because I know that people are going to start to get a lot of value, not just from this healthcare part of 7K Metals, but everything that the membership has to offer. But everybody needs access to good quality health insurance, and 7K is definitely providing an avenue for people to be able to do that.
100% agree. And guys, this is just one of the 10 membership benefits that we're going into today. There's lots more. We don't have time for all of them. But we got to see Todd out in Las Vegas at 7KX. And, of course, I asked him, knowing he knows everything about this industry, what's different or better with the new 7K healthcare plan, because that's not my expertise. So we're so happy he's here to just enlighten us and inform us about how much better this is getting and just how it can help really, average people out there get ahead in the world. So Todd Palm, take it away, my man. We're happy you're here.
All right, I'll do that. Let me share. Yep. All right. Okay, this is the 7K health plan. The health plan is administered by free market administrators, and they do a lot to give us more and more and more. So this is the second quarter updates. They did an update at the beginning of the year, and this is the most recent one they've done. So I'm going to have everything in here for you. So my name's Todd Palm, like Mike said, and I've worked over 30 years in the healthcare information technology on the health plan side. We call that the payer side. And I've been a consultant since 2009. I worked for this one health plan. We got tired of each other, so they laid me off. And that's when I decided I was not going to be anyone's employee again. And I've helped 4 different health plans implement the patient protection, and I call it the Unaffordable Care Act, because that's otherwise known as PPACA. And I've implemented benefits and pricing. So like when the doctor's office, they submit a claim, I'm the guy that implemented the configuration to make sure that it pays according to their contracted rate. So I've implemented HIPAA, you've heard of that. Sarbanes-Oxley, you probably haven't heard of that. Remember Enron, all the financial reporting? That was the knee-jerk reaction to Enron, Sarbanes-Oxley. Yep. There's now jail time associated with funny financial reporting, and that was that. So Y2K implemented all the changes in the computer to make it 4-digit years. ICD-10, which is the International Classification of Diseases, version 10, implemented that. The Medicare Part C EOB Diabetes Prevention Program. And most recently, I've implemented EIDVI. You've probably never heard of that. That's benefits for children, the vaccines for children. And the most recently, I loaded all of the COVID codes so there wouldn't be any member cost share. So I know a good bit about benefits and what goes on the payer side. Now, the 7K health plan, this is available to anyone who joins 7K Metals. There's no special qualifications to join. You don't have to reach a certain rank or have a certain amount of points. You just have to be under 65, because when you're 65, you're eligible for Medicare. And it's an alternative to the PPACA plans available on healthcare.gov, and it meets and exceeds the minimum essential coverage guidelines under the law. It's ERISA compliant, and it's administered by free market administrators. But the good thing, when you get your card, it'll say FMA on the card. But when you have people call in, they pick up the phone as, hello, 7K Health. That's good. Now, you have 4 health plan options now. SNI Plus, that's Sovereign Nations Insurance. Yes, that is the Indian health plan, but they're a sovereign nation. It's available to all 50 states. And SNI Mesa is the second plan. SNI Sierra is the next plan. And then SNI Primary Care. I'm going to go over what each one of those are. And then you have 5 supplemental plan options. Accident, critical, accident and critical combined give you the biggest bang for the buck. You get dental as a supplemental and vision as a supplemental. And here's the plans all together. So you can see primary care, there's no deductible co-insurance or whatever because it's all virtual. That's virtual primary care. The plus is very similar, but still there's no deductibles. And the Mesa plan, you're getting into the traditional one that has deductibles, co-insurance, and a lifetime maximum. And then Sierra, you get to pick your one of 3 deductibles because your premium also goes down the higher the deductible is. So that's what you have there. And there's $1 million lifetime max on the Sierra plan.
And so Todd, can you go back and stay on that page for a second? So if people have primary care and plus, they're only seeing a doctor with telemedicine. They couldn't go to a doctor like in real life.
You know, the primary care is the telemedicine part of it. The plus is the actual go to the doctor part of it.
Okay.
Yeah.
But neither of those have a deductible.
Correct.
Okay. And then the Mesa max of 3 for families.
That means if you have a $5,000 deductible and you have 3 people in your family, that's a $15,000 co-insurance and a $15,000 deductible to be met for a family.
Okay.
But if you have 5, 6, 10 more people than that, it's only times 3.
Okay. So if you're single, it's 5,000 would be out of pocket for the first, and then they would cover.
They would cover 100% up to the plan limit after your co-insurance is met. Yeah.
Okay.
Good question. Now, here's the Virtual Care Plus. That's available 24/7, 365, and 366 on leap years. It's a virtual clinic, 24-hour virtual clinic. You get medical help by phone, app, or a webcam. There's no travel, no appointments, no waiting rooms, no medical bills, and you get also virtual emotional and behavioral healthcare consultations. So that's for when your stress sets in, you're feeling alone, not knowing where to turn, or you feel uncomfortable asking for help. You get that consultation too, and that's 24/7, 365. And you get Value Script, prescription membership program. Top 50 medications are on the formulary. All prescriptions under $5 are free. And you get unlimited savings, and there's no waiting period. And you also get discount dental and discount vision with this primary care one. And this one is, you get lab testing. It's only $39.95 a month. So
I just got labs done, and I think it was like $400.
Wow.
It's crazy.
Yeah, so if you had the virtual lab here, oops, let me go back to it.
And they can, so like if you talk to a doctor in here, they can prescribe, majority of medications.
Yep.
Okay.
Yep. So this one, if you're reasonably healthy and maybe it's just you, this is kind of the plan for you, right? And that $39.95 a month, just about everybody could afford.
And is that it? Like, is there something else you're paying, or it's literally just $39 a month?
$39.95 a month. That's it.
Wow.
That's pretty good.
Yeah.
So to have access to a doctor 24/7.
It's unbelievable.
Yeah, because what that does, it keeps you out of the ER.
Right.
And so that's why they're able to do that so low. Now, the plus plan, if you're reasonably healthy and you're only looking for preventive care, minor medical services, or limited amounts toward major medical services, this is the reasonably priced alternative if you don't want or need maternity or major medical. And there's no deductible on this one. So you get primary care office visits, $35 copay. You get specialist office visits, 1 per year, and that's just a $75 copay. That wouldn't have helped with my physical therapy that I just went through. So preventive care visits. There's no copay after a 1 month waiting period's been met, except for colonoscopies, which you wait for 6 months. And then there's urgent care. You get one per year with limited coverage for ambulance, ER, and hospital and surgery. And there is a pre-existing conditions clause, but the pre-existing conditions doesn't mean you're not going to be covered. It just means you have to wait.
Okay.
So it's 24 months before coverage won't be, you won't have coverage for the first 24 months for ER, hospital, and surgical claims, except cancer. Cancer looks back 5 years. And that means if you've gotten a diagnosis, treatment, received a drug, that's a part of a pre-existing condition. So cancer looks back 5 years, but you still get coverage if you're pretty much clean.
Okay.
And you get the prescription drug coverage that average less than $5 per day. You get diabetes supply, high cost medications costing over $150 a month. You get an advocate online. They use Sharks Online. That's the name of their advocate. And they help you get these medications through pharmacy alternatives. So that's really good. And then you get no cost 24/7 access to your doctor via connected care, secure access to immediate medical care, physician created treatment plans, and no more waiting rooms, right? That's when you want to talk to your doctor now. And then you get the 3 mental health visits via a chat bot named Tess. It's almost AI, pretty good. And this is just the cost on the plus plan. So this one doesn't have an age breakdown. It's straight member plus spouse, member plus children or family. Not bad. And then if you're a tobacco user, you have to add $15 to that.
Okay, so the whole family covered for $339, $185 for a single, very affordable. That's way less than what I'm paying now for a single.
Oh, it's less than what I'm paying now too, but yeah, that's good. Oh, I forgot the bounce that was in there. All right, now the Mesa plan, this is more traditional health insurance that you're used to. This covers the hospitalizations, preventive services, maternity, and more. It has an individual deductible of $5,000, family deductible of $15,000, that's times 3. And then there's an annual coverage maximum of $100,000 and a lifetime maximum of $500,000. Coinsurance is 20%. So you have an out-of-pocket, the most you'll spend in coinsurance per year, which is $5,000 or $15,000 for a family of 3 or more.
Is your coinsurance what you pay after the deductible?
Correct.
Okay. So basically, you can get up coverage up to $100,000. So like, let's say you have a medical bill that's $50,000, you would pay your $5,000 deductible, and then you would max out at paying $5,000 for anything over that. So if your medical bills ended up being about $50,000, you'd end up paying around 10.
Correct. That's known as the out-of-pocket limit.
Okay.
So that's how much you spend out of pocket to receive services. Yep. And then your total out of pocket, which we were just talking about, that was a good segue. Individuals $10,000, families $30,000.
Okay.
You'll find that's very similar to a lot of plans, employer-sponsored plans that have the same thing.
Okay.
Because what's really happening here, because this is individual insurance, it's a question of who pays the risk. When you have an employer-sponsored plan, they're paying a percentage of your premium. That means the employer is paying for some of the risk. So here, more of the money goes to the individual. That's because the individual is paying for the risk. And that's going to happen with every individual plan everywhere.
Got it.
Now, the good thing about this is this plan and all of the S&I plans use the PHCS and the Provider Networks of America plan. That means there's over 100,000 doctors, specialists, and hospitals that are in network. And they just expanded their network in Hawaii in response to the Hawaii team's request.
Right.
There were already a lot of doctors there, but they were only on the Big Island, or they were only on Oahu, and they weren't everywhere else. So they've expanded and added more doctors on all the other islands.
Okay, awesome. And
Yeah.
for those people that don't know, 7K Metals has had extraordinary growth in Hawaii. I think we almost have half the people on the islands now in the company. So again, how amazing 7K Metals is they wanted to make sure they met the needs of all of their members. And so 7K Healthcare expanded their coverage to cover, like Todd just said, to cover basically, you know, most of Hawaii now because we have so many members out there.
Yeah. Now, this plan also has some services that aren't subject to the deductible, like preventive care and primary care provider visits. And then there's no copay if they're in network, and there's a $100 copay if they're out of network. But there's a little known law that everyday people don't know about. It was called the No Surprises Act. It became law January 1 of this year. And February 1st, health plans had to be able to administer this. That means if you go to a hospital and they send you to get labs or imaging or something like that, you have no control over whether those people are in network or out of network for your plan. You cannot be surprise billed now. They have to all be treated like they're in network.
Okay. So if you start in network and they send you elsewhere, that's going to be covered? That's
going to be covered because you have no control over that.
Okay.
That's the No Surprises Act. You've probably never heard that in the news. That's a little known law.
Listen, that's why you run with the runners and you talk to Todd about healthcare, so you know this stuff.
So now PCP and specialist visits, you get 4 combined per year. And then there's a $50 copay and then your co-insurance. And then a specialist is $75 and then your co-insurance. And you get 2 urgent care visits per year for your seasonal allergies, right? And there's a $150 copay for that and then 20% co-insurance. There's a lab discount program. You get access to over 50 labs, starting at just $15 with 50 to 80% discounts. Imaging, discounted cash pay for, we call these level 1, which is ultrasound, x-rays, CAT scans, and MRIs. And then facility and inpatient, that's 100% covered after meeting the deductible and your co-insurance up to your limit.
Okay.
And then ER, that's a hefty $1,500 copay if you go to the ER. But if you get admitted to the hospital from the ER, that copay gets waived.
Okay.
Now, the Mesa plan, it has the same pre-existing condition coverage schedule for the first 12 months. There's no coverage. This protects SNI and it protects 7K, you know, from going broke. If you have people coming in that have a lot of sickness that came with them, this is the schedule just to protect everyone, really.
Right.
So, but for the months 13 through 24, you get a coverage up to 15,000, and then the next 12 months coverage up to 30, and then months 37, you get full coverage up to the plan limits. And the same pre-existing conditions apply to this one too. Maternity, however, has a separate deductible. That has a $5,000 deductible, and then you pay co-insurance for a normal delivery. But the member's delivery date has to be at least 300 days after their effective date for it to be covered. So they're kind of enforcing a pre-existing condition here, but not really. That's what they called it that. And here's the prescription coverage schedule. So 30-day supply under 50, there's just a $10 copay, 50 to 149, a $20 copay or 20%, whichever is less. And then 150 to 400, there's a 40% copay, but you only get one of those per month. And then you get the same advocate Sharks online to help you get medications that are over $150 a month.
Okay.
And then you get the same connected care, no cost access to your doctor. So if you think about it, these plans also have some of what the primary plan does, where you get the virtual care as well.
Okay.
So that's secure access, physician, and no more waiting rooms. And then the mental health visits, you get 3 of those via the chatbot as well. These are the rates for the age breakdown. So it's as low as $218.79 for a member age 18 to 29 who's not a smoker, and as much as $896.51 for a family for a member age 60 to 64. So they always take it by the age of the primary member.
So this, I mean, again, 40-year-old, 241, whole family covered, 461. These seem like, is this quite a bit lower than what you would find out in the market or on, healthcare.gov?
Oh, absolutely. Healthcare.gov, once again, remember I talked about risk?
Right.
there were federal subsidies if you were under a certain income level on healthcare.gov, but if you weren't under that federal subsidy, you paid all the risk. That's why all the big deductibles came in there, but the rates didn't go down with a larger deductible.
Okay.
So this is significant.
So
And
if you're
even-
not, beneath the poverty line or getting subsidies from the government, I'm assuming you're probably paying like well over $1,000 for a
family coverage. For family coverage, typically, yes.
Okay.
Yep. And even employer-sponsored plans, they're taking out every paycheck. So for most people, they're paying their premium twice a month, and it comes out to more than this.
Yeah. I think my friend that works at the hospital, she pays close to $200 a paycheck just to get the insurance. And, then obviously the company, the hospital and the company is paying more, but that's just what she pays.
Right. The only benefit to that is when it's employer-sponsored, it's taken out pre-tax. So you have less taxable income. Right. That's the only benefit to it.
No, but you could still have an HSA and have this, could you?
You could still. Now 7K Health doesn't have an HSA to go with it, but if you still had an HSA, you could use that to pay for your out-of-pocket medical expenses.
Okay.
Now here's the Sierra plan. This is the newest offering. This one, you pick which deductible fits your situation. Right? This is the most comprehensive of all the packages. So you get non-emergent virtual care and you get behavioral health consultations at no cost. And then you pick your choice of deductibles, $2,500, $5,000, or $10,000. And then your coinsurance is 20%. And then you have an out-of-pocket yearly maximum of whatever your deductible is. So $2,500 for the $2,500, $5,000, and $10,000 like that. And then it's max times 3 for families. So it uses the same network, but preventive services, there's a waiting period if, for your pre-existing conditions. In network, there's no copay. Out of network, there's a $100 copay and the deductible doesn't apply. So this is a straight up pay without having to meet your deductible. PCP visits are $50 copay and then 20% coinsurance. You get 5 of those, but then after that, your deductible has to be met before anything is paid for. And that's typical, like every other health plan does that.
Okay.
And then specialist visits are the same way. You get 5 specialist visits with a $75 copay. And then after 5 in a year, you then have to pay your coinsurance up, and nothing is paid for until your deductible is met. You have a $125 copay for urgent care, inpatient, in and outpatient surgery, hospital, ER, and ambulance. That's your deductible and your coinsurance up to your limit. And then maternity, that's that same separate deductible as the other plan. And prescription coverage is the same as the other plan. And the same with high cost medications, you get the Sharks Advocate.
Okay.
This one is different. The others don't have chiropractic care. You get 10 chiropractic visits with this one. That would help me. I probably see my chiropractor 30 times a year.
Okay.
But this one, and that's a $50 copay with each. And then you get outpatient therapy. This is really comprehensive. $75 copay for that. Mental health, there's an annual max for it. You get in-person visits for a $75 copay. If it's virtual, it's free. Basic labs and x-rays, not in an office, just a $50 copay. Diagnostics, $100. Major diagnostics, a $400 copay, and then your coinsurance. And then low-cost medications, they've broken them down into levels. So this is how much you'll pay based on the level of the drug. And here's the deductibles. The higher the deductible, the lower your premium. So, for example, the $2,500 deductible for a member 18 to 29 is $327.84. But the $5,000 deductible, it goes down to $320.62. The $10,000 one goes down to $286.60. So this works opposite the way the Unaffordable Care Act plans do. It's opposite.
Can you go back one slide to right there? So you have, you'd have a family of, 4, 5, 6, 40-year-old, you're paying around $1,000. And I'm looking at this, seeing ages 40 to 49, you know, for the $2,500 deductible, you're only looking at $378.
Yep.
So I'll ask the question when you're finished, but yeah, go ahead. So just so you guys understand, I know it's hard to understand insurance and, you know, what else is available out there. But I mean, I remember 5-7 years ago when Obamacare first kicked in, or the Affordable Care Act. And I mean, people were paying like $1,500 a month, $1,800 a month. Like they were like, I can't afford this. I don't know what I'm going to do.
When I joined 7K back in November of 2020, the first thing I saw was the benefit wheel the next day, and I saw we had healthcare. And I was blown away by that because I was paying $2,796 a month for family coverage for an Affordable Care Act plan.
Wow. That's just crazy. I don't know how anyone can survive having to pay that.
Well, it was within $100 of what I was paying for my mortgage. I mean, it was getting to the point where it was not sustainable. And but when I joined the 7K health plan, it immediately put $886 per month back in my pocket.
That's awesome.
Huge.
Yeah. So, and you can see the $10,000 deductible, every one of the premiums goes down versus the one at 5,000, the 2,500 and 5,000.
Yeah, I mean, then you got family of 4, you're paying, you know, $736. You know, if you're in your 40s, $688 in your 30s, even up to in your 50s, you're still under $1,000 a month for an entire family. I mean, it's just unbelievable.
Right. And if your family is larger than 3 people, you just get the biggest bang for the buck.
Oh, yeah, for sure.
Yeah. Now, these are the supplemental plans. And now, do you have a question on the other one?
No.
Okay. Now, you have accident coverage, and you get to pick your coverage maximum, and all of these come with a $250 deductible. And this is for 12 months. It renews every year. And this is what it's covered. It covers your hospital room, your doctor fee, anesthesia, everything that you would normally be charged for in the hospital, right? Even physical therapy, nurse expenses, drugs, durable medical equipment, ambulance, everything. This is what it would cover for an accident. Accidental death and dismemberment, same $250 deductible. You pick your level of coverage that you want. And then here are the rates for the accident plan. So it's not a heck of a lot of money added onto it. Look at it. It's as low as $31.93 for a member for $2,500 of coverage, as much as $79.13 for a family for a level 4 of $10,000 of coverage.
And so this is just something you would add on if you wanted like extra coverage and protection from bad things happening.
Peace of mind. Yep.
Okay.
And then there is there's a critical coverage. Now, this is kind of like Aflac. You can use this to pay for your out-of-pocket medical expenses, routine monthly bills. It's money given to you. You use it however, kind of like Aflac.
Okay.
And this one, these are the premiums on it, as low as $38.93 for level 1 for a member, or as much as $148.32 for level 4, which is $10,000 of coverage for a member and a family. Now, they give you the biggest bang for the buck by combining the accident and the critical. So you get both, the benefit of both, for a lower premium than either.
So you're kind of here just looking at the first one, just a member. So you're getting basically $10,000 of coverage for critical and accidents for $94 a month for a single, $202 for a family.
Yep.
Okay.
There's also dental that's available. So remember, the virtual plan had the dental discount and the vision, so you didn't need to buy that separately. There's dental here.
And so if when it says preventative dental exam, so if I go like twice a year for like my cleaning and whatever, would that be covered then?
Your preventive dental exams and the x-rays that go with it are 100% covered. And there's no waiting period. Now, as long as you go in network, you get the biggest bang for the buck. They use the Carrington Dental Network.
Okay.
And this is what you get. So year 1, year 2, and year 3, all of the class 1 stuff was the exams, the x-rays, the cleanings, the palliative treatment, and the sealants for children 15 and under. That's 100% covered. So that answers your question.
And do you get this with all 4 of the plans or just the two that are more expensive?
You get this with all 4 of the plans. You can pick that. I know, true. I don't know if you can pick it with the virtual plan.
The one that was just $39?
Yeah.
Okay.
I don't know if that's an option to pick that, but I know with the rest of the plans, this is available.
Okay, so what was the second one? Not the one all the way to the left, but the second one.
The Plus.
Yeah, that one you would get this?
Yes.
Okay.
Plus Mesa and Sierra, you have access to this.
Okay.
And for your basic services like fillings, extractions, crowns, and stuff like that, that's 40% coverage year 1, 80% year 2, 90% year 3, then 100% after that.
This is better than the dental insurance I had when I was a teacher, by far, not even close.
Oh yeah. And there's more. There's class 3 services. These are inlays, onlays, crowns, and prosthetics. 20% coverage the first year, 50% the second year, 60% year 3, and then it goes up after that. And then there's orthodontics. If you have children under the age of 19, you get orthodontic coverage here up to $1,500 per year with a $50 or $150 deductible. Not bad. Actually, it's children up to 19.
Okay.
Yeah. And like I said, it uses the Carrington Dental Network. You get the biggest bang for the buck if you go to them. These are the rates for the dental. Not bad. Now, the benefit that I like the most here is the vision. This by far, VSP is one of the national vision providers.
I've heard of them.
I have the new every 2 with VSP. I've had it for years and years and years. This beats VSP's rate. And I'll show you on the next slide. You get eye exam and every year, and you get your frames every 2 years. This is about half the cost of what I'm paying VSP. So you get frames every 24 months. You get 100% on the lens, regardless of what it is, whether it's single, bifocal, trifocal, progressive, it's 100% coverage.
Okay. Wow.
You get polycarbonate lenses, which is what mine are. You get $85 allowance to that. And then ultra progressive premium, you get an $89.50 allowance to that. And then contact lenses, same applies. Once every 24 months, you get coverage up to $100, and then non-elective stuff is 100% coverage as long as you go in network. The coverage is less if you go out of network, but this is a really good benefit. And it gets even better. It uses the Superior Vision Provider Organization. You have in-network access to over 114,000 there, and you get the best benefit when you go in network. These are the rates. Look how low the rate is for a member versus a family. This is one of the best benefits that they have.
Yeah, you can. Right.
You know? And there's pet insurance.
Yeah, I got to know about this. When they told us this on the call, I was like, are you kidding me? Do you know, I have so many friends that complain about, they're spending thousands of dollars to help, their pets live, a few more years.
I just spent $150 to have my dog's teeth cleaned. This is the Telebark Pet Virtual Healthcare. You get an unlimited access to a dedicated team of veterinarian telehealth specialists. It's available 24/7, 365, and the uses for it are common questions, second opinions. You can discuss behavioral issues. You can talk about wellness, and they can even give you training guidance. And you can get help understanding if you need to take your pet to the ER.
That's huge, because I know a lot of people struggle with should I do this? Is it that big of a deal? So the fact that they can call up 24/7, 365 is phenomenal.
Yeah. And then you get a pet drug savings card. How big is this? You're guaranteed to receive the lowest price available. And there's 20,000 different name brand and generic FDA approved drugs on the formulary. So there's no income, there's no age or no pre-existing condition limit, and there's no deductibles.
Wow.
And here it is, one price for all the domesticated pets in your household. Domesticated is the key word right there.
Yeah. So no horses or pigs or anything like that.
Well, if they're a little potbelly pig and they're in your house, the way that they made it sound, the way Scott made it sound, is all the pets in your household, regardless of what they are, lizards, iguanas, snakes,
Okay.
they're pets.
Well, all right.
They're in your household. They're covered.
I mean, this is just unbelievable. We're gonna have to start talking to people that have pets, Ricardo. I mean, you can't. This alone is gonna pay for your 7K membership and all your gold and silver for the year.
Yeah. Now, here's a case study. If you didn't put 2 and 2 together when I showed you the health plan. So let's pick an individual member between the ages of 18 and 29. They select the $2,500 deductible Sierra plan, which is the most comprehensive of the plans, and that's $327.84. And they also select the combined accident and critical $2,500 coverage, $44.29. They select the dental coverage and the vision. And the member picked enough accident and critical coverage to cover their out-of-pocket Sierra plan deductible costs, right there. And the monthly cost for this piece of mind, $450.41.
So all that.
Yeah, but even better, what if they picked the $5,000 level of accident and critical supplemental coverage? That would cover not only their deductible, but their co-insurance out-of-pocket amount too. And the premium would only increase $1,751 to a total of $467.92.
Unbelievable. This is amazing. The things they're doing to help people just never stop. I love it.
Yeah. And there's something in it for you if you're in 7K. You can offer the health plan to employers with 5 or more employees. That was a change. It used to be 2, now it's 5.
Okay.
And each member on your team, when they pay their premium and they have parts of the health plan, they can generate up to 34 points every month just from the health plan and the pet insurance is 5 points alone every month too. All that counts toward commission. And you have a link in your back office that you can share with employer groups. So when you click 7K Health Group Plans, what shows up in your address bar is the unique link that you can share. So I just use GoDaddy. I redirect it to a shorter URL, and I share that with people. And then these are the provider lookup tools. So if we had time, we could actually click the link, go look up providers in different places, but you can actually copy the link, go and look yourselves.
Perfect.
So that's it.
Absolutely amazing. Just unbelievable what 7K can do. And that's where, so like that was my big question, Todd, was what is in network? Like, are hospitals around me covered? So I'm definitely gonna get those links and go and look, because that was my only hesitation in joining. But from what you showed me, if the networks are around where I'm living, I'm a fool to not join this right now.
Oh yeah, PHCS is the largest network in the nation. So there's a good chance that your doctor is in network.
Okay. Ricardo, we want to get your take on what Todd just delivered here. I'm blown away, but I want to get your thoughts about just how 7K is hitting it out of the park. So go ahead and unmute yourself. And, this is just amazing.
Yeah. Oh, man. I mean, it gets better and better. It's definitely improved. I'm excited because I know that people are going to benefit huge from this. I mean, just earlier you heard how Todd explained he was paying about $2,700 or so for insurance. And, since with 7K, he's pocketing $800, almost $1,000 a month at that time. Right, Mark? I mean, it's huge. It's huge. And I think that, obviously people can see the value in this membership. So that's why you want to get the membership. This is why you want to share the membership, put yourself in position to create a passive income, but also provide solutions for people with their healthcare in addition to building wealth. Health and wealth, it goes together. And with 7K in this membership, we're taking care of people's health and their wealth. And that's phenomenal.
It just keeps getting better. When they say we're just getting started, there's not just a saying, they're being serious. So if somebody sent you this video or you're watching it later on a replay, don't, necessarily reach out to us. Get back to the people that share this video with you and get your membership today as quickly as you can with 7K. There's no way you can lose with it. We're winning. We're going to keep on winning.
Yep.
Todd, thank you so much.
Yeah,
for coming
definitely,
today.
Todd. Yeah, please, thank you.
Oh, thanks
Awesome
for having me.
presentation.
I really appreciate it.
Awesome presentation. So many people are going to benefit from this presentation that you did this afternoon. Thank you, brother.
Oh, you're absolutely welcome. Thanks for having me, really.
Any last words, Todd, you want to add, maybe just to encapsulate and help people see the big picture about, what an amazing platform and coverage that 7K has put together here?
Well, when you join 7K, like I said, this is a benefit that you get. No special qualifications. You have access to it. Now, when it's health plans, an employer-sponsored health plan, that's your best option if you want to be an employee, for one, because they're paying a part of it and it's pre-tax. This is sitting right in the middle, right? This plan is good for you. It's right in the middle. The Affordable Care Act plans are last. So this is right square in the middle for you. And I think that's the nice target that they aim for. And it's really beneficial.
All right. Awesome. Thanks again. Appreciate everything you do.
All right.
Thanks for jumping on, Ricardo. Appreciate everyone watching this. We're winning every day. We look forward to inviting you guys into the family. So get back to the person that shared this video with you and get started on your journey to freedom today. All right. Lace up. Let's get wealthy, guys. Peace.
All right. Peace.
Building wealth, buying assets, about to buy me an address. I'm running with the runners now. We run where the cash is. Took it from under the mattress. Now it's all over the atlas.